name is Caitlin and I'll be your vet nurse for today. We'll just be discussing a little bit of information regarding parasite prevention and a vaccination plan for your new puppy. So it's lovely to meet both of you. I'll just start off by asking, what was puppy's name? Fluffy? Lovely. So I can see here in your file that Fluffy is a 9-week-old female border collie. She was born on Gumtree and her vaccination certificate indicates that she was vaccinated and wormed at 8 weeks of age, which is great to hear. So I'll start off just talking a little bit about vaccines and then I'll move forward and talk about parasite prevention. Vaccines are used to introduce your puppy's immune system to potentially fatal diseases to help her build a natural defence. So the booster vaccines must be given around 3 to 4 weeks apart, as the maternal antibodies that Fluffy has from her mum are now decreasing. So as she was vaccinated at around 8 weeks of age, I would recommend that she gets a second vaccine at 12 weeks of age, a third at 16 weeks, and then it'll just be a yearly vaccination for life. The vaccine that we would recommend is the C5 vaccination, as it not only covers the 3 core diseases, which are distemper, parvovirus and hepatitis, but it also covers parainfluenza and bordetella, also known as canine cough. Not only will dog vaccinations protect your dog, but they will also ensure that she doesn't infect any other dogs in the local community. Early dog vaccinations will allow you to socialise Fluffy earlier on with other dogs. An up-to-date dog vaccination history is required in places such as boarding kennels, doggy daycare and dog training classes. Just places where dogs typically interact closely with one another. Now that we've spoken a little bit about vaccinations, I'm just going to move forward and talk about heartworm. So I just wanted to ask you, is Fluffy on any heartworm preventatives at all? No, that's okay. So a little bit of information about heartworm. It's a potentially fatal disease and it's characterised by large parasitic worms and they can infest the heart. So continuous lifelong prevention is vital as all dogs are at risk whether they're indoor or outdoor. What we would recommend is the ProHeart SR12 injection. The first injection would be at 12 weeks of age. So when Fluffy does come back to get her 12-week vaccination, we can also administer the ProHeart SR12 12-week injection as well. After this, she will need another injection at around 6 to 9 months of age, and then it'll just be annually injections for the rest of her life to ensure that she is protected. Puppies under 7 months of age can be started on heartworm prevention without a heartworm test, as it takes about 6 months for a dog to test positive to heartworm after they're infected. The good thing about ProHeart SR12 though is that it has something called a reach-back effect. So this means that it kills any immature heartworm acquired before 12 weeks of age. The frequency of this one is because it needs to be used in puppies, as ProHeart SR12 is a slow-release preventative, and as puppies do grow rapidly, the dilution of increasing body mass may affect the duration of protection. So that's why it's really important that she does come and get the 12-week injection and then afterwards gets the 6 to 9 month injection. Another alternative for heartworm prevention could be an oral preventative such as Milbamax. I will talk more about this one in detail shortly, as this is what I've chosen for your worming preventative. But with Milbamax, if you are wanting to make this a heartworm prevention, it will need to be given every single month. I will just touch on what is important to protect dogs against in terms of parasites quickly now. So not only is it important to protect heartworm, like we just spoke about, it's also important to protect dogs against fleas, ticks, mites, roundworm, hookworm, tapeworm and whipworm. So as I just previously mentioned about Milbamax, this is the product that we have chosen for worming control. So with puppies, it is recommended that they are wormed every 2 weeks until they are 12 weeks of age. So it is great that she was wormed at 8 weeks, but she will need to be wormed again at 10 weeks and then again at 12 weeks. After this, she will need to be wormed every month until she is 6 months of age, and then every 3 months for the rest of her life. This initial frequency is needed as puppies can get worms from their mothers if their mother has been carrying infestation. So puppies can be infected in the uterus, or they can be infected by ingesting her milk. Milbamax provides control against roundworm, hookworm, whipworm, tapeworm, and it can control heartworm as well, like I said earlier, if this product is given monthly. The dosing rate for this one, so if Fluffy is between 1 to 5 kilos, she will just need 1 tablet. And if she is above 5 kilos, she will need 2 tablets. And this one is the formula just for small dogs and puppies. Now that we've spoken a little bit about Milbamax and the worming prevention, I'm just going to go on to speak about flea and tick prevention. So I just wanted to ask you, is she on any flea or tick control at all? No, that's okay. So the product that I've chosen for today is the Brevecto Chews. These are great as they only need to be used once every 3 months, and they are safe for puppies to use from 8 weeks of age. So she could even start these today. The Brevecto Chews provide full protection against fleas, paralysis ticks, brown dog ticks, ear mites, Demodex mites, scarp tick mange, and they also aid in the control of flea allergy dermatitis. So we definitely recommend these ones. Like I said, just a once every 3 month administration. And there is also something I just wanted to touch on briefly. I'm not sure if you're aware, but many herding breeds, most commonly collies and Australian shepherds, they have a mutation at the MDR1 gene. It makes them a little bit more sensitive to the negative side effects of certain medications. But in a well-controlled laboratory study, Brevecto was shown to be safe in collies known to be the MDR1 gene defect. So collies with a defect were administered 3 times the deliverable dose and they had no adverse effects. That's why I definitely recommend Brevecto to be part of your parasite prevention plan. Overall, I think that's everything we need to discuss today. So like I said, I definitely recommend the Milbamax for your worming prevention and your Brevecto for your flea and tick control, as well as the ProHeart SR12 heartworm injection. I believe that's everything we need to discuss today. Thank you. Have a great day.